An introduction to liver diseases in special populations: children, elderly, and pregnancy. Introduction. The burden of liver disease in India is difficult to assess, since the epidemiological data is not robust as in most parts of the world. However, the available data shows that cirrhosis and its complications, such as hepatitis B and C, alcoholic liver disease, and non-alcoholic liver disease, are the major reasons behind the increased mortality rate in India. In India, about 26% of children are diagnosed with non-alcoholic fatty liver disease, NAFLD, in 2020. Hepatitis E-induced acute liver failure is associated with a very high mortality rate in pregnant women, which is somewhat unique to India. Factors affecting children. Just as in adults, the paradigm shifts in the etiology of liver diseases in children with metabolic liver diseases, including obesity-related fatty liver disease, have been observed in recent years. Similarly, another shift observed is that the prevalence of the severe undernutrition-associated fatty liver disease has declined, whereas the prevalence of obesity with NAFLD is increasing exponentially. This increasing prevalence of fatty liver disease in children in developing countries has been noted to be parallel to the increase in the prevalence of obesity. In a cross-sectional study done on school children aged between 5 to 10 years, it is observed that around 19% of children with normal weight and 37% of overweight children had NAFLD. Factors affecting the elderly population. On the other hand, in the elderly population, the increase in incidences of liver diseases has been attributed to aging factors. Several studies have shown that aging could affect clinical characteristics and outcomes in patients with liver diseases. Both liver volume and blood flow decrease significantly with aging. These changes and decreased cytochrome P450 activity can affect drug metabolism, increasing the susceptibility to drug-induced liver injury. Further, these changes in immune functions alter the pathogenesis of viral hepatitis and autoimmune liver diseases and the development of hepatocellular carcinoma. Several studies have reported age as a risk factor for liver fibrosis and a higher mortality rate in patients with NAFLD. Additionally, older patients can have other significant risk factors for NAFLD, including hypertension, obesity, diabetes, and hyperlipidemia. Thus, aged patients with NAFLD are considered to have advanced liver disease. Factors affecting pregnant women. Meanwhile, in pregnancy, liver diseases can be categorized into liver disorders that occur only in the setting of pregnancy and liver diseases that occur coincidentally with pregnancy. Some examples are hyperemesis gravidarum, preeclampsia, eclampsia, syndrome of hemolysis, elevated liver enzymes, low platelets, acute fatty liver of pregnancy, and intrahepatic cholestasis of pregnancy. These pregnancy-specific disorders can cause elevations in liver function tests and hepatic dysfunction. Challenges to managing the condition. The challenges of managing these conditions optimally are many, including limitations of resources, hepatologists, and healthcare facilities, differences in culture beliefs, dependence on untested and unproven traditional medicines and herbal supplements, lack of universal education and awareness of diseases and their modes of transmission, increased prevalence of underlying poverty and malnutrition. The vaccination rate for hepatitis B in children is less than 50% in most parts of India. And this, along with other challenges, is likely to derail the attempts at hepatitis B reduction in India unless and until central and state governments enforce the existing regulations.